I recently underwent a stem cell transplant and wanted to give others who are considering doing the same a brief guide as to what to expect before, during, and after transplantation. Transplantation of the patient's own stem cells can be an effective treatment for blood malignancies, including leukemia and multiple myeloma. Following a diagnosis, the majority of patients who have blood cancer are able to live a long and healthy life if the appropriate treatment plan is followed. Stem cell transplantation is a common component of this treatment. Stem cell transplantation is sometimes known as high-dose chemotherapy, bone marrow transplantation, or transplantation of umbilical cord blood. People who have blood cancer and have exhausted all other treatment options or who have a significant risk of acquiring secondary leukemia are candidates for this therapy option. Stem cell transplants can be performed as part of the treatment plan for your cancer, but they can also be put off until a later time if your doctor feels that this will enhance the outcome of your treatment. Learn more about what to anticipate from your stem cell transplant by reading this helpful information. A stem cell transplant is described here. It is possible to treat cancer with a procedure known as a stem cell transplant, which involves the replacement of damaged blood-forming cells with healthy ones. The healthy blood-forming cells from the patient are removed by the doctor and transplanted into the receiver to replace their damaged counterparts. The healthy cells can originate from one of two distinct places: either the donor's own blood-forming cells or stem cells extracted from human embryos. Both of these options are viable options. Stem cells are undeveloped cells that can be found in the bone marrow of humans of all ages, but are particularly abundant in children. Stem cells have the potential to differentiate into a wide variety of cell types, including blood cells. The stem cell transplant procedure is a rigorous treatment that may not always succeed in curing cancer. However, it may be an effective course of treatment for certain patients whose cancer does not react favorably to other therapies. What to anticipate in the days leading up to your stem cell transplant. You will first be subjected to a battery of examinations to determine whether or not receiving a stem cell transplant is in your best interests, and whether or not it is safe for you to do so. In particular, your medical team will want to make sure that the progression of your cancer is proceeding slowly enough to allow for the transplant to be carried out before the disease becomes more widespread and potentially fatal. You will also have tests to determine your general health, your risk of infection, and your ability to tolerate the high-dose chemotherapy that will be used to destroy your diseased blood cells and make room for the new ones. These tests will determine your ability to tolerate the high-dose chemotherapy that will be used to destroy your diseased blood cells and make room for the new ones. Last but not least, you will undergo blood tests to decide which sort of donor cells will benefit you the most. Stem cells taken from the patient themselves, stem cells taken from a member of the patient's family, or stem cells taken from an unrelated donor. What to anticipate over the course of your stem cell transplant. In most cases, a stem cell transplant will be performed in two distinct stages, one after the other. Phase 1 is the preliminary phase, during which the doctors provide strong doses of chemotherapy to the patient in order to eliminate any damaged blood cells, make room for the patient's new cells, and eliminate any cancer cells that may still be present. The second phase of the treatment is known as the transplanting phase, and it is during this phase that the doctors will either use the patient's own stem cells or cells collected from a donor in order to repopulate the patient's blood cells and perhaps achieve a remission that is long-lasting. In contrast to the first phase, the transplant phase is a straightforward, one-step process that is completed in a matter of hours. During the phase of the procedure known as the transplant, it is possible that your blood cells will be increased in a laboratory using a method that is analogous to the process of growing bacteria in a petri dish. When there are a sufficient number of them, they are collected, frozen, and kept in storage until they are ready to be transplanted into new bodies. Recuperation following the transplantation of stem cells. The time it takes to feel back to normal after undergoing a stem cell transplant might range anywhere from a few days to several weeks. After the transplanting phase of the treatment, the adverse effects that are most frequently experienced are those that are caused by a compromised immune system. These adverse effects may include infections, fevers, or headaches. It's also possible that you'll feel fatigued or have trouble sleeping, and there's a chance that your taste buds or hair will change. You might even lose your hair. There is also the possibility of long-term health repercussions, such as weakening bones or an increased risk of certain infections, depending on the type of transplant that was performed and the type of cells that were utilized. Important advice for individuals who have undergone a stem cell transplant. Maintain an active lifestyle. Maintaining an active lifestyle and maintaining up your strength might assist you in making it through the arduous therapy with less anguish. Maintaining a healthy diet will help you keep up your energy levels and reduce your risk of illness while you are undergoing treatment. Maintain adequate hydration. It is important to maintain adequate hydration in order to ward against weariness and maintain a healthy immune system. Managing stress is important because it can make the therapy more challenging. Take medications precisely as directed. Be sure to give great attention to the directions that your physician gives you for taking medications. Check both the amount of medication you are taking and the timing of when you are taking it to ensure that you are doing both correctly. Take precautions to avoid contracting an infection to reduce your risk of contracting an infection while undergoing treatment. It is important to take precautions such as avoiding contact with ill people and often washing your hands. Stem cell transplant patients are strongly encouraged to maintain open communication with their treating physicians throughout the course of their therapy, particularly in the event any difficulties emerge. Take care of your health. Although stem cell transplantation is an effective treatment, it does not ensure that the patient will be cured of their condition. Closing remarks. The challenging but effective cancer treatment known as a stem cell transplant has the potential to put the disease into long-term remission. It is not applicable to all forms of cancer, but it provides a treatment option for a significant portion of patients who have blood malignancies. Patients who are considering getting a stem cell transplant should be aware that the transplant procedure itself is a challenging operation that will almost certainly result in some short-term negative effects. This article has provided an overview of what patients can expect from a stem cell transplant as well as how they can get ready for this rigorous kind of treatment.